Hi, Sophie. It's Danielle. I just wanted to say that after listening to Dr. Forth's podcast about the Missouri Comprehensive School Counseling Program and reflecting upon it myself, and then listening to your video, I felt like, or I thought that we had similar views about the comprehensive model versus clinical mental health counseling, and how they vary. That the clinical mental health setting is not just about curriculums and lessons, it is more, client based or client centered. I also found what you said about telehealth, especially with COVID, interesting. And so I found an article called Attachment Based Family Therapy in the Age of Telehealth and COVID 19. It was written by Levy, Mason, Russin, Diamond, and it was in the Journal of Marital and Family Therapy from the National Library of Medicine. And it went on to discuss the importance and the necessity of telehealth in the day and age that we live in with COVID. And it went on to discuss that telehealth by its nature is kind of a home-based therapy, which is extremely different from the comprehensive school program. And it talked about how, when you enter a client's home or their family system, when you're doing a telehealth type consultation or an appointment, that you have greater access to multiple family members. Therapists have more capacity to understand factors that affect all the different family members that are meeting for therapy over telehealth. And it was extremely important that telehealth be an option for low-income families who may not otherwise come to face-to-face counseling due to having to pay for childcare or transportation to get there. And then it also kind of avoids the entire stigma of getting mental health support because you are in the safety of your own home. So I found that while the comprehensive school counseling program and the clinical mental health setting of counseling differ, that telehealth creates an even broader diversity between the two, because from just what I've read, that is definitely an option that clinical mental health counselors are going into and have more of a schedule for, as opposed to school counselors who are following the comprehensive school counseling program and are working with a certain type of client in a specific environment.